Hi, I'm Connie Likas. I'm a registered dietitian. I have worked most of my career in the maternal and child health space as a pediatric dietitian and also with pregnant women in a variety of settings. And I'm very pleased today to be presenting the Healthy Baby curriculum that I worked on with Healthy Klamath and OHSU, the Moore Institute. So today we're going to go through the curriculum. We're going to start today with the pre-module, which is really a background for the people that will be using this out in the field. So all of you in your communities that will be working with patients and clients, pregnant women, and even women who are contemplating pregnancy, this can be a useful tool. So I'm going to start today with the first what we call the pre-module, which is, again, this is information for you to understand the scientific basis of this curriculum, Healthy Body, Healthy Baby, Healthy You. There's kind of a dance between the science and why we know it's so important for healthy eating and healthy lifestyle. So there's the science, but then there's also the practicality. How do we make this information meaningful to our patients and clients? So as we go through, and especially as we get into the modules, you'll understand, some practical strategies and tools that you can use for making this information meaningful and for meeting your patient and client where they are right now. So I will go ahead and get started with the pre-module again, which is the scientific basis that will help you to understand why we feel that this is so important. So my objectives today are for you to gain an understanding of this basic science and principles of what we call DOHAD. That is the developmental origin of health and disease, to understand the relationship that we understand between healthy birth weight and positive outcomes for the baby, receive an overview of all four modules that you will be teaching, and embrace that role of how to communicate these concepts to your patients and clients, because the bottom line is we want to promote positive behavior changes. It's great to understand the science, but really the end goal is for positive behavioral changes. So when you get started with this, I want you to focus and maybe take a minute to think of one concern you see with the eating habits of your patients and clients, and something that maybe you've noticed, you're concerned about, maybe a little frustrated, and also to identify maybe some barriers. So maybe your patients and clients have a family situation, maybe they have, a living situation, a financial situation. What types of barriers? Perhaps they live in a food desert and can't easily obtain all the healthy foods that they need. So, what are some possible solutions, and how can this program assist you? And also, I want you to always think about being a partner with your patients and clients. So, we don't want to be in the position where we're lecturing and we are just, it's just going top down, where we're the expert and we're giving advice. It's much more effective in behavior change if we learn to partner with our patients and come up with individualized and effective strategies for improvement. So, meeting your clients and your patients where they're at. So, my goal through this curriculum is to provide, again, practical and actionable advice to help your patients and clients. And now we're going to get started with the DOHAD quiz. and a review of that science. Hopefully, all of you have accessed that online. The DOHAD quiz is one of the handouts that you will see. And we're going to just go through the quiz. Hopefully, you took it, but if you didn't, we'll go through it right now. So there's a saying in DOHAD, you are what your grandparent ate. And we're used to hearing you are what your mother ate or you are what your parents ate. But what does it mean when you say you are what your grandparent ate? So, the answers, you'll share the same food likes and dislikes. B, during gestation, the ovaries are forming eggs that may eventually become the grandchildren of the pregnant person. The usual diet is most often the same diet, or your grandparents ate a poor diet. So the correct answer is during gestation, the ovaries in a female fetus are forming eggs that will eventually become the grandchildren of the pregnant person. In other words, so my grandmother, that's where I started. My mother was forming her ovaries, and with a female with ovaries, you get them all at once. We do never come up with more eggs in our whole lifetime. So that is a key, that's a key moment. I have two grandchildren now, so when I think about that, these grandchildren actually started with my daughter inside my womb forming her eggs. It's kind of mind-boggling, really. Number two, all but one of the following events during pregnancies known to influence the future health of an infant: poor nutrition, exposure to chronic stress, such as poverty and racism, toxic substances, or springtime conception, excuse me, and toxic substances. And a few of those would include lead paint, smoking, substance abuse. And the one that's not linked is springtime conception. So poor nutrition is linked to the future health of the infant. B, exposure to chronic stress. And that is different than daily stress. Stress we feel if we're caught in a traffic jam or something just doesn't quite go our way. Those little stresses that annoy us through the day. We're not talking about those stresses. We're talking about chronic stresses that often are systemic and passed down through generations, such as poverty and racial disparities. And of course, toxic substances, which again are sometimes linked with socioeconomic circumstances. So old homes with lead paint and those other types of toxic chemicals that might be in the water, in our houses, and tend to happen again more in low-income areas. So number three, Dr. David Barker, an epidemiologist who studied birth and death records in England, noticed that low birth weight was associated with an increased risk of death from heart disease in adulthood. And that is true. Dr. David Barker is really kind of the father of DOHAD. And he noticed when he studied records dating back to even the early 1900s in England, and then following up with the outcomes of these people, that the low birth weight babies would have a much higher incidence of heart disease and early death in, say, their 50s or 60s if they were low birth weight. Another thing that he noticed that was kind of a natural, unfortunate experience was the Dutch hunger year of 1944 and 45, when there was a famine and a lot of low birth weight babies, unfortunately. And again, these people, as they grew up, had a disproportionate increase in heart disease and other chronic diseases. So he started to really look into this, and he also was a big partner with Oregon Health Sciences University prior to his death, um, in starting this whole movement in research, in education. If we could make a difference in early pregnancy and have babies who weighed, a normal, somewhere between 7 and 9 pounds, which is what we generally consider in kind of the normal range, that they would have a step ahead in life in terms of their chronic disease risk. Number 4, during the first 1,000 days, and remember that begins with conception, and that goes to about age 2. The following are true. So, A, B, C. I'll just speed ahead a little bit because all of these statements are true. We've already alluded to poor nutrition during this stage can actually result in irreversible damage to the growing brain. So we get about somewhere around 80% of our brain mass in the first 2 years of life, in the first 1,000 days, and only about 20% for the whole rest of our life. So that early brain development is so important, and we can't do much about it after the fact. So we need to focus on conception and then through age 2, and of course, lifetime, but that's just a very critical period. The quality of diet during pregnancy in this period affects the future child's risk of developing chronic conditions such as obesity, diabetes, and heart disease later in life. What happens is, a baby who is not receiving a proper nutrition, will not fully develop all their organ systems. They usually will prioritize things that are essential to life, but they may not have, for instance, their kidney function or liver function, their pancreatic function, which controls, insulin. Those things will not be as fully developed if the quality of diet during pregnancy isn't there. So C is a supportive environment, a nutritious diet, and avoidance of toxic substances during the first 1,000 days contributes to both healthy babies, and remember, you are what your grandma ate, healthier future generations as well. And finally, number 5 is about breastfeeding. So studies so far show, and studies are continuing, but infants who are exclusively breastfed for at least 3 months have all but one of the following. So I'm just going to go ahead to the answer here. So they're not going to have a greater likelihood of food allergies. It's interesting with food allergies, that's actually being studied. And there is some thinking that breastfeeding may be protective for some food allergies. Again, that's under study, but certainly not a greater likelihood. So what does breastfeeding, what advantages will it confer? Well, a lower incidence of obesity during childhood and adolescence, a decreased incidence of both type 1 and type 2 diabetes in childhood. Those are actually kind of different diseases. Type 1 has more of an autoimmune and even possibly a viral cause, whereas type 2 diabetes tends to be a little more lifestyle related to weight and lifestyle factors. but breastfeeding is protective against both. And believe it or not, slightly higher intelligence scores and higher teacher ratings, even until age 8 in studies during childhood for infants who have been exclusively breastfed. And that's for at least 3 months. I mean, we always hope and recommend that babies are breastfed longer. 6 months, a year is great, and even longer than that if the mom and the baby want to continue to do that. So again, what is DOHAD? And just through going through the quiz, I think we have a pretty good understanding now. It's based on the observations and research that point to the environment in fetal development that influences the health and chronic disease risk in later life. So right from the start, we could make such a difference in public health just by having healthier babies. Environmental exposures. So we're talking about a lack of proper nutrition, and that's what this curriculum focuses on. Exposure to chronic stress, which I described as more the intergenerational toxic stresses such as racism and different disparities and poverty, and exposure to harmful chemicals so alcohol, cigarettes, illegal drugs, mercury, lead. And these exposures slow the development of a fetus and at various points can impact how the brain, heart, kidneys, liver, pancreas, and all the organ systems are forming. Another thing I wanted to mention that sometimes we overlook is the research with the placenta. A lot of times we just don't think too much about the placenta, but it really is a pretty incredible organ. It's an organ that your body forms specifically in pregnancy. So, we don't have a placenta other than during the course of pregnancy. If you've ever seen it, it looks almost like a large liver. And it's pretty incredible that your body does that. But it is an organ that filters all kinds of things, all the nutrients and the oxygen. It removes harmful waste. It provides immune protection. It even produces hormones that support fetal development. So there is more interest now, too, in how nutrition and lifestyle affects that placenta because the placenta is directly linked with the health of the baby. There is something called the Human Placenta Project, and you can click on this link for more information if you want to read up on that. But again, all the things we're talking about in terms of nutrition for the baby also will help us to, produce a healthy placenta. And problems with when we don't have a healthy placenta, that's when we see conditions such as preeclampsia, more gestational diabetes, more early preterm birth, and also the growth restriction, intrauterine growth restriction. And some key messages that you will be communicating during this curriculum. So again, good nutrition during the critical periods, like the first 1,000 days, supports the development of the structure and the function of all the body's organs and systems. And when the fetus is undernourished, it uses the available fuel, the available nutrition to prioritize the growth of the brain and the heart, but you may see other biological systems compromised, such as the kidneys, again, liver, pancreas, and just the first 1,000 days, we can provide a healthier future by improving access just to nutritious foods. And it will shape the health of the future children and grandchildren. It's what we call the 100-year effect. I alluded to a woman is born with all the eggs she will ever have. So with men, they continually produce sperm throughout their life cycle, really. And yet women are born with all the eggs that we ever have. And that's another reason why our reproductive years are much shorter than, say, compared to men. So men in their older years still are viable in terms of producing offspring, but women, have a much shorter window of reproductive health because as we age, our eggs age. And then, of course, we go through menopause, and then our eggs, and reproductive systems aren't working at all at that point. So the eggs that could someday become the children were nourished while the woman was a fetus inside her mother's womb. Risks for chronic disease can be passed down through the social and environmental exposures of one generation to the next. So when we talk about chronic stress, it is something that is passed, and it is a cycle in terms of stress, living in an abusive or a very poor, situation that can create chronic stress throughout generations. And, it goes without saying, today's children are tomorrow's parents. So starting this 100-year effect right now with our population can really make a big difference in public health for many generations to come. And a healthy environment and access to nutritious food will help children succeed in life as the next generation. Our adult health is shaped during the earliest moments of our life. And this is also going to affect education with higher IQs, fewer behavior problems, and a higher likelihood that they will succeed in school. We need more than 40 essential nutrients to construct both a healthy placenta and a healthy baby. And we'll be going over these throughout the curriculum, but just a few to highlight: protein, carbohydrates, especially whole grains, legumes, whole fruit, things that are nutrient dense, healthy fats that impact brain and visual development, iron. A lot of pregnant women of all socioeconomic classes, still iron deficiency is very common. We'll discuss folate and folic acid, calcium for bones, vitamin A, vitamin D, which again has many roles, including bones. And the curriculum will stress how parents can supply these nutrients at various stages of pregnancy through their food choices and also appropriate prenatal supplements. And each module will focus on the developmental highlights for that stage of pregnancy, reinforce the relationship between what we eat and the developmental stages, engage patients and your clients with meaningful discussion, and also encouraging them to take action steps, to set goals, to identify barriers, to go through all those behavioral exercises, and emphasize that a balanced diet rich in whole foods is the best way to meet the developing baby's needs. And this is just an overview of what we'll be covering in this curriculum. So module 1, the building blocks of eating well, that is at the first trimester, or those who are even considering becoming pregnant in the next year. We'll talk about the brain and spine, focus on fruits and vegetables, And these are some of the topics that will be covered. And that includes a better plate, key nutrients, energy and weight, morning sickness, which is a big barrier sometimes in eating well in early pregnancy, and also the importance of food safety. Module 2 will focus on the second trimester, and we'll talk about what's happening with bones and early organ development. The food focus is on protein and dairy. And at this point, you'll get a lot of questions now about weight and managing your weight throughout pregnancy, type 2 diabetes, and also conquering some of those cravings that we sometimes have in pregnancy. And module 3, we're going to be talking about the third trimester, and the developmental highlights are continuing brain development and also bone and calcium uptake. We'll focus on whole grains and fiber. And by the third trimester, a lot of women are going to be having digestive upsets, the heartburn, reflux, constipation, and we'll talk about dealing with those, fitting in movement and activity, even in the very later stages of pregnancy, still keeping active, and also hydration. And that's something that is often overlooked, but very important as we increase our blood volume and our fluid needs, and the baby's fluid needs are really increasing towards that last stage of pregnancy. And then module 4, we're going to focus on the postpartum period with an emphasis on lactation and the growth and brain development now that is going on once the baby is born. Easy, healthy meals, because it is a very busy time. So having things that are easy and quick, and we're sleep deprived and all these things that are going on. So ways to continue to eat well and to support lactation. And we'll talk about simple budget-friendly meals and snacks, eating while lactating, and also seeking support for lactation, because it's not always, just because it's natural doesn't always mean it's easy. So anyone who has experience with breastfeeding, especially with your first baby, it is a learning curve for both mom and baby. And also infant formula support when needed, because breastfeeding does not always work. And there are times where you may need partial formula, or breastfeeding may not work out, or it may work out for a few months and then maybe your work or life situation. So we'll talk about supporting whatever feeding choice, and not feeling guilty or judgmental about that.